Welcome in everybody. Before I get started, I would like to express my gratitude to be able to present this virtual webinar from Kingston, Ontario, situated on the traditional territory of the Anishinaabe and Haudenosaunee peoples. While I'm in Ontario, the rest of the One Yukon team and our offices are situated on the traditional territories of the Tonquachin Council and the Kwanlin First Nation. We're thankful to be able to be a part of discussions around health and wellness on these lands. So today, our webinar called One Health in Action, Integrating Wastewater Data for Better Health Outcomes. We're going to be diving into a topic that's increasingly important in public health and has become a large focus at One Yukon, and that's the concept of One Health. Let's get started. All right. Here's a bit of an idea of what's on the docket for today, starting with objectives, One Yukon overview, and flowing right into the topic of One Health and the Yukon context. Also, throughout this presentation, please click the Q&A function on the bottom ribbon, and we will get some of those questions answered by the end of the presentation. So here's a few objectives for this session. First, we aim to understand the One Yukon programming. It's essential to kind of grasp how our initiatives fit within the broader One Health framework, emphasizing the interconnectedness of animals, humans, and the environment. Next, we'll highlight the importance of Indigenous knowledge and community collaboration. This is critical in ensuring that One Health initiatives are culturally relevant and beneficial. Lastly, we will explore the role of One Yukon in these health initiatives, particularly within the Yukon context. Before we dive a little bit deeper into One Yukon, I want to give a nod to the folks who make all of this happen. It's the passion, commitment, and expertise of this team who turn ideas into reality. Looking to our board of directors, we have Mathia Latini, our Chief Executive Officer and interim board chair, who leads our vision and strategy, and we'll actually be hearing from her a bit later on. Joining her are our committed board directors, Carrie, Amanda, Jerry Lee, Allison, and Allison. Additionally, we have Carolina, our Chief Operating Officer, who ensures our operations run very smoothly. There's Sherry, our Program Manager, Katie, Program Associate, and Mohammed, who together with myself make up the OYC epidemiology team. Now that we know who's on the team, and before we get into the bulk of the webinar, I want to give you a brief peek into what One Yukon Coalition does. So One Yukon is a non-for-profit organization that focuses on improving health outcomes for Yukoners and works to transform health and wellness systems across the territory. Our mission is to improve community access to health and wellness resources by bringing communities together and building community-driven partnerships. Some of the main ways we do this is through data collection and information sharing, which are centered around the principles of OCAP: ownership, control, access, and possession. We work with First Nations communities, municipal and federal governments, and other organizations to access data with the goal of closing the gap of health data available to the public. This improved access to data and deeper understanding of a community-based health issues of concern aid us when we are preparing to face the next public health emergency, whatever that may be. We've developed powerful relationships within the territory to expedite information sharing, proactively address issues of concern, and have the technologies that would allow for a timely change in direction to address an emergency and scale up operations like our wastewater surveillance program. Together, our organization seeks to empower change, bringing folks together and building partnerships that are driven by community needs while providing resources needed to build and enhance capacity within the territory. Now let's take a peek at a couple of our programs and see how they fit into our mandate. If you've worked with One Yukon in the past, it's probable that it was on one of these main programs. Firstly, we have our wastewater program, recently rebranded as the Canadian Wastewater Intelligence Platform, and because we love acronyms in Yukon, Can-WIP for short. I'm going to be chatting at length about Can-WIP in the next slide, but in a nutshell, this is our wastewater-based monitoring program that allows us to keep a finger on the pulse of community health. Our rapid or point-of-care testing program began with the distribution of COVID-19 test kits and PPE during the pandemic and has evolved to include testing that targets sexually transmitted and bloodborne infections, or STBBIs. We are working with individual Yukon First Nations communities to provide point-of-care tests, such as the Insti Multiplex, which tests for HIV and syphilis, as well as the HCV or Hep C point-of-care test to address liver health in the territory. Last but not least, One Yukon has developed a microsite embedded within our own website called Ask Auntie. This was born out of a campaign from Science Up First called Together Against Misinformation, in hopes of providing vetted and accurate health-based resources to Yukoners. This is an increasingly important topic in today's digital age, where misinformation on health-related topics, such as vaccines, is so prevalent. As promised, I'm going to spend a little bit more time chatting about the Can-WIP program. Can-WIP at its core is an interdisciplinary platform that allows us to generate, analyze, and share data-driven insights. It connects researchers in northern, remote, and isolated communities, or NRI communities, to initiate wastewater-based monitoring programs that produce the data needed to address the issue of concern. This platform has three main pillars, which echo the overall mission of One Yukon. The first pillar is pandemic preparedness planning through the continuous development and adaptation of wastewater-based monitoring technologies. Ensuring the sustainability of these programs is top of mind and guides our desire to create a wastewater-based monitoring playbook for other communities interested in implementing a similar program. It also highlights the importance of developing a robust data governance structure. Secondly, it's the aim of Can-WIP to prioritize building community capacity, specifically within Yukon First Nations communities, to ensure that our initiatives don't only provide data, but empower change. Finally, several of you may be familiar with the respiratory dashboard that we've created that monitors the wastewater signal for flu, RSV, and COVID-19. This dashboard, along with others created to monitor substances of potential abuse, for example, ensure the timely distribution and engagement between the data collected and the community it reflects. Now we're going to shift gears quickly and spend some time talking about the concept of One Health, which is why we're all here today. After a bit of an overview, we're going to shift back to One Yukon programming and talk about how it specifically fits within the scope of One Health. So with a large influx of interest in One Health, there's a number of definitions that you might have seen floating around, but what we're going to do is look at the World Health Organization. They define One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. This approach requires participation across sectors, communities, governments, and everyday folks to tackle health threats with the understanding of the interconnectedness of our world. To do this, there's 5 underlying principles of One Health. First, there must be equity between different sectors and disciplines. For example, medicine, microbiology, sociology, livestock specialists, policymakers, economists, and so much more. They must have a space at the table. There's a need to recognize fairness in opportunity and resources to ensure diversity in knowledge. Secondly, socio-political and multicultural parity, or the belief that all are equal and deserve equal rights and opportunities. This ensures conversations between everyone and does not exclude marginalized voices and communities. The third principle is socio-ecological equilibrium, which is a fancy way of saying that there needs to be balance between human, animal, and environment interaction, while also acknowledging the importance of biodiversity and valuing all living things within an ecosystem. The fourth principle speaks towards the responsibility of humans when it comes to making behavior changes and adopting sustainable solutions which amplify the importance of animal welfare. This is essential in ensuring the well-being of current and future generations. Lastly, transdisciplinary and multi-sectoral collaboration that includes traditional and modern forms of knowledge, disciplines, and perspectives. Before we talk about the state of One Health today, I think it's important to look to the past to see how much the concept has grown. Starting close to home in the 19th century, Canadian physician Dr. Osler, who served at McGill University, taught that there's a deep connection between human and veterinary medicine and is considered to be the father of veterinary pathology. Dr. Virchow, a German pathologist who was a student of Dr. Osler, coined the term zoonosis to explain the transmission of an infectious disease passed between humans and animals. I know this is not a standard timeline, but jumping forward to 1964, we find Dr. Schweb, a accidental veterinary epidemiologist who proposed the collaboration of health professionals to combat zoonotic diseases. He coined the term one medicine, which emphasized the similarities between human and veterinary health disciplines and the need for collaboration to prevent, cure, and control illnesses impacting both animals and humans. In 2004, the Wildlife Conservation Society gathered human and animal health experts to a symposium which would create a set of principles called the Manhattan Principles. These 12 principles were created with the understanding that, quote, to win the disease battles of the 21st century while ensuring the biological integrity of the earth for future generation requires interdisciplinary and cross-sectoral approaches to disease prevention, surveillance, monitoring, control, and mitigation, as well as to environmental conservation more broadly. These principles form the basis of the One World, One Health concept. In 2007, representatives of 111 countries and 29 international organizations met during the International Conference on Avian and Pandemic Influenza, where they encouraged governments to keep building linkages between human and animal health systems in the name of pandemic preparedness. In 2009, we had the Public Health Agency of Canada hosting experts from 23 countries for the One Health, One World from Ideas to Action expert consultation, which further discussed the Contributing to One World, One Health framework, which was previously released in 2008. Now, kind of crazy, but we're going to chunk together a whole decade here. We see continued efforts to operationalize One Health, including the tripartite concept note on long-term strategy and international responsibilities. The adoption of a One Health approach by the United Nations and the World Banks. We also see the hosting of the first International One Health Congress and One Health Summits. So bringing it to today, summits, discussions, conferences, they've all continued into the present with the One Health Joint Plan of Action set from 2022 to 2026, which is supported by the One Health High-Level Expert Panel and outlines the role of the Food and Agriculture Organization of the United Nations, or the FAO, the United Nations Environment Program, or UNEP, World Health Organization, the WHO, and the World Organization for Animal Health, or the WOAH, in the support and implementation of One Health actions. These four organizations now make up the quadripartite, and together they aim to achieve the goals that no single organization can achieve alone. Knowing a definition and the history of a concept is fantastic, but when it really comes down to it, what does One Health do and refer to outside of academics and textbooks? I think this figure does a great job of contextualizing One Health to help us understand the real world impacts and how interconnected everything is. So let's start with zoonotic diseases. We see that over 60% of infectious diseases in humans originate in animals. We've seen firsthand the effects of SARS, Ebola, COVID-19, and avian influenza. These aren't abstract concepts. You've felt the impact of a global pandemic and how it shifted global health policy and impacted our daily lives. Now think more on deforestation. Between 1990 and 2020, the world lost over 420 million hectares of forest, according to the FAO. That deforestation pushes wildlife closer into contact with people and livestock, increasing the risk of disease spillover. In places like the Amazon, they've already seen this contribute to outbreaks of malaria and leishmaniasis due to habitat changes for disease-carrying mosquitoes. From an animal health perspective, about 20% of global animal production losses are due to disease. Environmental stresses weaken animals, and sick animals can become sources of infection for humans, especially when surveillance and veterinary services are limited. Now let's talk about antimicrobial resistance, or AMR. This is a textbook example of a One Health crisis. The overuse of antibiotics in humans, animals, and agriculture contributes to resistant bacteria, bacteria that doesn't respond to our current treatments. The global threat is massive, with figures estimating that AMR could cause 10 million deaths annually by 2050, surpassing cancer. So as we look at this figure together, I want to underscore the simple truth. Sick environments breed sick animals, and sick animals lead to sick humans, and the cycle continues. Before we move on to the One Yukon, One Health approach, it's important to address the role of Indigenous knowledge within the One Health sphere and how the timeline of this concept began long before the 19th century. For this, I'm going to turn over the mic to our CEO, Mithia Latini. Mithia is a Southern Shoshone matriarch and a member of the Kluane First Nation, and is a huge advocate for health and unity across the Yukon, and is a leader in Northern communities, health programs, and community engagement. So over to you, Mithia. Thank you.
Wonderful. Thank you, Justine. I'm really enjoying this information sharing opportunity and the opportunity to really share that the integrative, let's go back a little bit more in history on what the Indigenous perspective of One Health is. And we have always, I grew up traditionally in the bush and had the privilege of living off the land. So to me, I always thought that the idea of taking care of the land because it takes care of you, taking care and respecting animals, was an understanding that everybody had. And that is not the case. And we see in Western science a very siloed approach to all of the things, to AMR, to illness in animals, illness in humans, and then further in humans, we see a breakdown or a siloed approach to illnesses in humans. From an Indigenous perspective, we have always looked at the integration of human, animal, and environmental health. It is very much interconnected. So we, in modern day times, so back in part of Yukon history, an anthropologist interviewed one of our elders, and it's a documented interview. She was an anthropologist. She wrote a book called Part of the Land, Part of the Water, and we'll put a reference to that in the chat. That is really good reading to help understand through story, through someone's life story, that whole concept of how you take care of the land, how you take care of the water. So really, as an oral history, peoples, we have always carried on that oral history of how we take care of our land in order to take care of ourselves. So in other Indigenous cultures in Canada, we have the medicine wheel, which talks about balance. There's that physical, mental, emotional, and spiritual aspect. And that's a standard practice, not always embodied by a medicine wheel in every Indigenous culture. Thinking of Canadian Indigenous people as pan-Indigenous is something that we have to move away from. But the rooted understanding of balance and being able to look at things from how are you making decisions to support your physical well-being, your mental well-being, your emotional well-being, and your spiritual well-being. There's a group of youth that have been doing amazing work here. And really, they were talking about climate crisis and how do we address the challenges that youth are seeing in our territory. We have a toxic drug crisis. There's lots of overdose deaths. There is suicides. There's a lot of young people dying young. So we had a group of youth come together and they created something called the Reconnection Vision. And that's at reconnection.vision, easy one to look up. And it is a path to deal with all of these crises. And the underlying principles of it are ill people cannot take care of the land. So they've created a direct link to climate action and well-being. So the principle of creating well-beings if you have well beings, you will have a well family. Though that well family will take care of a well community or create a well community. That well community will have enough wellness to take care of the land around it. So it is about that creating some balance and reconnection to land that will address climate action. And it's a really amazing, um, thought-provoking process to walk through. And in some ways, it's so simple, but it pushes the boundary of our Western understanding of where we are and everything for me. Um, so it is, I'm going to recommend that. We'll put that link in the chat as well. So this interconnectedness between land, humans, and environment, or lands, animals, and environment, we're seeing that in science. So Justine had talked about the antimicrobial resistant bacteria and the infections that get into humans. But one of the things that we're seeing right now is the distribution of H5N1, so avian flu. And that is of concern right now in the territory as we see migratory birds coming back north. And how do we address and monitor and just think about that potential for transmission between animals and humans, especially as people who still live a subsistence lifestyle where we are going out hunting and our animals, our dogs, could get exposed to birds that have H5N1. So this has given us the impetus, I guess, to go and look at partnerships to monitor things like eDNA and monitor for H5N1. So that is something that we're looking at because when you think of that transmission between migratory birds and populations in our communities, it's not that far removed. And we saw transmission of COVID. So we know that there's a lot of zoonotic transmission, so from animals to humans. And being able to take that kind of ancestral understanding of our integration into land, our interconnectedness with animals, and use modern tools such as eDNA and to track that and create the linkage to knowledge for everybody else in the community. We want to be able to say, we're seeing detection here. You need to modify your practices. And when you think of traditional ecological knowledge or TEK, we would always be, as scientists on the land, Indigenous people are scientists on the land, you're constantly watching and observing changing landscape, changing waterways, changing migratory patterns, and you're adapting. You're adapting your hunting practices. You're adapting where you camp and how you utilize the land and how you harvest. So that these modern science tools are just the same type of traditional practices that we would have used previously, but it's using modern science. One of the other things that from integrating One Health as we see it now, and that historic way of thinking is this transition from this Western model of crisis-oriented, dealing with things in silos. We're only dealing with this one problem discreetly, as opposed to looking at what is the actual cause of this? How can we do preventative medicine? How are we taking care of land, animals, humans, creating that well-being and doing it in a holistic framework? So one of the things that we're looking to do is creating well-beings through knowledge, creating well-beings and allowing for a new way of thinking to come out, because we're not wanting to just treat ill beings. This really does come down to individual health and the health of community. One of our other, I think, foundational practices, and Justine mentioned it, is around data sovereignty and integration. We want to make sure that Yukon First Nations, who have self-government and who are self-governing and work tripartite with Canada and Yukon government, have the data sovereignty and are able to make decisions for community in a good way. We want to make sure that we are presenting information in a different context, creating a holistic dashboard that looks at animal health and water health, not just the water from the land, but water that we're drinking. And then what's the image of health for our actual communities? What's our individual health look like? What are our indicators of health? And how are we meeting those indicators and presenting a holistic picture of the health of community? So in closing, I think I just want to comment that as has already been mentioned, that One Health is not new. It is a ancestral knowledge for me, and I'm really proud of One Yukon and our team for bringing forward and carrying this into the world of science, into the world of Western health. And I am really appreciative of the efforts to bring balance to our responsibilities and to our relationships. And I want to reiterate again that, as Angela Sidney said, we are part of the land, we are part of the water, and this is where healing begins. Thank you. Shonitan.
Thank you so much, Mithia. Absolutely brilliant. I know there were two links that you mentioned as well. If we're unable to post them in the chat, we'll send a follow-up email to everybody to make sure that you guys can see those resources because they're fantastic. So looking forward, a lot of this is going to sound really familiar. And Mithia did a great job in integrating the next kind of topic we're touching on, which is the Yukon context of everything. So it's hard to break kind of these categories apart because of all the interconnection. But let's start on kind of on the risks to human health from zoonotic diseases. So when we think of things that are zoonotic in nature, I think right away, Lyme disease having an upward spread from the southern provinces with higher temperatures. And some species of ticks actually move 46 kilometers per year in parts of Canada, bringing that risk of Lyme disease on animals to humans in areas that were previously unaffected. There's also a higher risk in Yukon and other northern territories of a parasitic infection that is caused by tapeworms, of which caribou is the immediate host. And while this parasite kind of sounds like, exotic Echinococcus, it's actually already been identified in dogs and wildlife in Alberta and in the Northwest Territories, putting Yukon in the north on alert, considering the close relationship between working and companion animals. There's also a concern for food security and safety, given the reliance on hunting and fishing as a food source. This moves us smoothly into animal health, where once again, it's important to recognize Yukon as a home to a variety of wildlife, and monitoring the health of these species, such as caribou and salmon, is essential. Hunters, trappers, and land guardians are crucial in identifying illnesses and changes to the health of Yukon wildlife and the monitoring of fish and game for sustainability, as well for looking out at quality and safety for consumption. There's also something that you might have considered before, and that's the connection between domestic animal health and the Yukon to the One Health approach. As with many northern, rural, and remote communities, there's often a shortage or geographical barriers to reaching veterinary care. This is important when you consider the transfer of diseases to humans by pets that can be prevented through proper, regular vaccinations. For example, things like rabies. Looking more towards environment health, climate change affects both animal and human health. Rising temperatures can lead to changes in migration, and as mentioned before, can affect human health through zoonotic transfer. Think what Mithia was saying, H5N1 or avian influenza. mining and industry contamination to the environment through the leaching of heavy metals or chemicals. Legacy mines like Faro raise concerns of metal contamination in waterways, which don't just affect fish, but every level of the food chain. Adding in mental or melting permafrost, and we're facing a world where ancient pathogens that were previously locked away might resurface. The maintenance of biodiversity and ecosystem health is of the utmost importance in Yukon, and it can't be taken for granted the role that clean air and water systems have on the support of both human and animal health systems all across the territory. So in epidemiology, we love our 5 Ws. We've got who, what, when, where, and why. They're the foundation of how we understand any public health issue. We've already covered the who. We've got One Yukon, our partners, Yukon First Nations, governments, and the communities we serve. The what is One Health, the holistic interdisciplinary approach to health that brings people, humans, and environment together. The when is right now. We're in the midst of changes. The where, of course, is across the Yukon with all its unique ecosystems, cultures, and challenges. And the why, which we touched on throughout the session, is because our health is all interconnected. To improve outcomes for one, we need the support and support the health of all. But is this kind of where the discussion ends? No, because there's a secret sixth question, and it's just as important, and that's how. How do we actually put the One Health approach into practice in a way that reflects Yukon's context, values, and priorities? We're calling it the One Yukon, One Health approach. So let's get started with the environment. One way we're doing this is through collaboration in eDNA research, which stands for environmental DNA. This technology helps us detect genetic material of organisms present in water, soil, or air. It gives us a non-invasive way to monitor biodiversity, track species, and even understand ecosystem shifts over time. But technology alone isn't enough. Building and maintaining strong relationships with hunters, trappers, and land guardians, who are often the first to notice changes in wildlife behavior, migration, or health, is crucial. Their observations and insights are critical to a holistic One Health strategy. Another tool is water table mapping, provided by a link we have through the Yukon government. Understanding how these water systems move through the territory helps us see how contaminants, pathogens, and even animal populations might travel, interact, or move across ecosystems. Looking at the human side of the equation, we're continuing wastewater monitoring for respiratory illnesses like RSV, influenza, and COVID-19. This helps us detect and respond to outbreaks quickly, sometimes even before symptoms show up at clinics. We're also participating in national programs to track antimicrobial resistance, or AMR, through wastewater, which is an emerging and critical threat to public health. Monitoring substances of potential abuse in wastewater, particularly in Whitehorse, gives us valuable anonymized data to support mental health and substance use services in real time. We're also expanding our point of care testing, or POCT, for HIV, syphilis, and hepatitis C to improve access to early diagnosis and treatment, especially in communities that face barriers to traditional health services. And through the Ask Auntie program, we're continuing to share reliable, culturally relevant health information, combating misinformation, and helping people make informed choices about their health. Finally, we come full circle with the animal side. We're incorporating eDNA with the geomapping of animal migration patterns. This gives us a bigger picture of how climate, animal movement, and human health are intertwined, helping us predict and prepare for emerging risks. Through all of these tools and partnerships, One Yukon, One Health isn't just an idea, it's an evolving approach that supports healthier communities, stronger ecosystems, and a more resilient future. Because at the end of the day, a healthier Yukon for all of us means the health of people, animals, and the land. Instituting the One Health approach through collaborative efforts, accessible dashboards, and meaningful collaboration will have a positive impact on the health and wellness of Yukon communities. It also means that data will be available to all. Engagement with academic institutions in and outside of the territory will allow for the collection and distribution of knowledge across disciplines. This includes the continuous engagement with traditional knowledge keepers and land guardians to ensure a holistic understanding of wellness. In the Yukon, the One Health approach requires an interdisciplinary collaboration to address the interconnectedness of the health of animals, humans, and the environment. and this is particularly important in the context of the region's unique ecosystems. As we look forward to the future, it's crucial to integrate One Yukon, One Health during this transformative period in Yukon's health system, ensuring that Indigenous knowledge will be considered throughout. Upcoming projects include an integrated One Health dashboard. You'll see a couple examples flashing to the right, which will allow for the weaving of various data sets. For example, our own wastewater data, publicly available drug monitoring data sets, food security information, and community health data. This centralized database will allow for the tracking and analysis of data accessible to the public, enriching communities' understanding and the collaborative perspective of health and wellness from human, animal, and environment. We're also creating a One Health microsite to help introduce folks to One Yukon, One Health. And this will allow us to continue to do more dedicated education and engagement strategies. These resources altogether will empower communities to actively participate in these health initiatives and foster a culture of collaboration. Wrapping up our presentation for today, I just wanted to touch on a couple key takeaways. First off, when it comes to One Health, collaboration is key. This approach can only work when a commitment is made to interdisciplinary and multi-sectoral collaboration. We need to foster strong connections. Next, data drives action. Using wastewater technologies, eDNA, point-of-care testing, and other innovative technologies, we can put together data in accessible format like public data dashboards. The last and most important takeaway is that any solution or proposed innovation must be built around sustainability and inclusivity. The One Yukon, One Health approach emphasizes the importance of sustainability, cultural sensitivity, and the empowerment of Indigenous communities in health decision-making. This ensures that future health interventions are effective, equitable, and respect the unique needs of the Yukon's diverse population. That's all we have for today. I think we hit the 40-minute mark almost perfectly. What I'll do is I think we have a Q&A button at the bottom. If you're interested in asking any questions about One Health generally, or the One Yukon, One Health approach that we're going to be rolling out, please do post those questions. And if possible, somebody on our team, myself, Mathia, Carolina, or anyone else who's on the call will kind of field those questions.
I see Katie has put a couple of questions in the chat for us. Maybe I'll take that first one because it says, Medea, how is OYC building trust with communities to ensure that First Nations leadership is authentically embedded and not just consulted? So a lot of this work with One Yukon has come out of collaborative relationships during the pandemic. And what we saw was First Nation governments as authorities in our communities determining what the priorities were. So when we're doing wastewater monitoring in a community, we actually formulate an agreement with the nation, and the nation as the government is the one that's holding the data. And we form that partnership with the municipality, who normally owns the infrastructure in the adjacent municipality. And we also have to look at the partnership with the Public Health Agency of Canada, National Microbiology Lab, because they process all of this information. So we end up having a complex data sharing agreement, and that any changes to that data sharing agreement are done through conversations. And think of the shift from detection of respiratory illnesses to the detection of substances of potential abuse. There's a lot of opportunity or potential for stigma to be attached to communities when you're monitoring for substances of potential abuse. So how that information gets shared, who has access to that information is all considered when we're looking at developing or amending any data sharing agreements. So very much done in a respectful manner and from a position of relationship. Thanks.
I wonder, Mathia, if I could prompt you to answer this one as well. How do you see the One Health framework evolving over the next 5 to 10 years in the context of climate change and increasing urbanization in the North?
I think that's a really important question. We're seeing that the Yukon Territory has had, post-pandemic and started during the pandemic, one of the highest growth rates of any province and territory in Canada. And that has definitely had an impact on everything: housing demand, uh, employment, all the infrastructure, our electrical system. And it's also having a demand on our wildlife. People come here because you can still go out hunting, and we have to really question, is that sustainable? And in order to answer those questions, we have to have data and we have to be able to make informed decisions. So what are those additional impacts? What are the numbers? What is the sustainability of a given population of moose in a given area? And we have to do that very transparently. And we have to show the interconnectedness. If a waterway is no longer supporting life, think of if that is the case from the Eagle Gold uh, breach, then we have to think of, where do those animals go? Would they go into another game zone? Is that game zone going to change the hunting numbers? Or we have to have a holistic picture of animal health, human health. What are the demands on the land? And how is the changing land going to, how are we going to adapt our practices based on the information that's provided? So I really see our dashboards as being that informed, holistic source of information that can integrate a lot of those areas and help community members and help decision makers make policy decisions and, if necessary, legislative decisions.
And I think this question, anonymous attendee, I think it's great because um, 5 to 10 years from now is important to look at, but also the next generation, the generation after. The One Health approach needs folks to not just look now in time, but look to the past, present, and future to ensure that the health of these ecosystems are continuing through generations and that the changes are being made with that forward thought in mind. So 5 to 10 years would make a huge difference, but imagine 50 and 100 years. What's the context going to be? What it's going to look like if we don't start now?
I'm not sure if that was a question or a statement. I think,
No, that was just a statement. It was a great question in the
yeah.
Q&A.
Um, and I think we answered the other question around navigating community concerns around privacy when integrating wastewater data into public health monitoring. And we're doing it in a very conscientious way. I should state that we are also looking to the expertise of the Chief Medical Officer of Health, the Yukon Public Health Evaluation Unit, and uh, looking to the expertise of the frontline healthcare workers that are delivering services, especially around these substances of potential abuse.
Yeah, for sure. I think that covered the two questions that I'm seeing, and then the collection of them all kind of answered all at once. So unless there are any other questions coming, I'd say thank you so, so much. Oh, is there another question? Okay, sorry. One more question. Any ideas to collaborate with other First Nations communities to scale up the wastewater based monitoring initiative in One Health? Also, how do you see this approach collaborating with the larger One Health approach in Canada, just thinking about the public health vision of 2030? Fantastic question. I know we're continuously collaborating with Yukon First Nations, building these data sharing agreements, building these relationships that allow us to identify, what is of interest, and then proposing options for solutions. And then when the solution's chosen, we work and provide the resources and capacity to make that happen. But as it stands right now, with the kind of wrapping that into the bigger Canadian approach. Mathia, I know you have a lot of connections in this realm.
Yeah, maybe I'll just add. Um, Thanks for that, Zishan. The frameworks that we are developing with our self-governing nations here in the territory, so the integration dashboards that have public health information, they have the land and the water information, so wildlife and water, um, is a template that can be emulated, shared throughout Canada. And we do have quite a few collaborative relationships with nations across Canada. So we do talk about the work that we are doing, and there is a lot of interest in what we're developing. We are very thankful to have Justine and Mohammed as our epidemiologists who have a unique set of skills together, very complementary in being able to take all of this information, create dashboards, and actually translate, because it's great to have all this science out there and all this data out there, but if you can't translate that into something that people understand, then you're missing the mark. And that's where Justine's skills come in around data translation and being able to share this information in a way that is understandable in community and that can be utilized for community members and for decision makers. Thanks. I'm seeing one more from Casey. Thanks for this interesting webinar. Is there a specific definition for transdisciplinary that one Yukon likes to use? How's this defined? Is this something we discuss a lot at the University of Calgary?
It's a good one.
Yeah.
I don't think we've specifically talked about like a one Yukon definition for this, but I think it's a great idea if we were to have a terms or definition list. Because generally, like transdisciplinary, we're thinking about the collaboration across disciplines, across sectors, and we need to make sure that we're reaching outside of just academic disciplines, academic sectors. And I think that would be really unique to have a definition that fits within the One Yukon, One Health context, especially when we're looking at the complexity of the populations, the complexity of the ecosystems, and all of the different sectors and disciplines that we need to consider when coming up with any sort of approach to address a complex problem that has to do with One Health. So I don't have an answer for that. But I would love if we came up with one. I think that'd be fantastic.
Yeah, and maybe just an example of transdisciplinary. We could think of the environmental monitoring, EGNA. Every community member has, or every First Nation community has some type of land guardian, land monitoring program that does observational reports on the land. And being able to integrate that type of observational reporting to and adaptive reporting to environmental monitoring as a science and integrate that type of information is very much, and then you look at, okay, we're integrating environmental science and water monitoring. How are we building that knowledge set and respecting the knowledge from community as actual science? I think that's another piece around this. How are we looking at things holistically? We're respecting that, yeah, you may not have a PhD, but your experience on the land is part of that transdisciplinary work, and we respect that. Thanks.
Yeah, that's fantastic. I think we'll probably talk more about that in the future. I don't see any other open questions in the Q&A chat, so I think we'll wrap it up here. I just want to thank you all very much for attending. We appreciate you giving us your time and your ears during super busy time, I'm sure, for all of you. So thank you very much. The recording for this, the resources that were linked in the chats, they're all going to be available either on the website if you'd like that, on YouTube, or through an email that we'll send to all attendees, kind of just following up on the webinar as well. So thank you very much. I hope you have a fantastic week, and we hope to see you again soon.
Nishchi Shonithan Gansanu.